Xylazine, commonly known as Tranq, coming to a homeless encampment near you in the immediate future. What is it, you might say? You've never heard of it? We're going to get into it. We're going to talk about it. We're going to talk about how dangerous it is. All right, let's do this. If you haven't already, make sure to head on over to reasonabletv.com. Got a members section there. You've got news content that you're not going to find anywhere else. We're dropping at least 2 new podcasts per week. I'm creating more content than the vast majority of channels out there that charge $10 a month. Yeah, I'm just giving you more. That's what we're doing here. You're not going to want to miss. Let's just pick a random topic here. Oregon has the highest rates of meth and prescription opioid abuse in the nation. I haven't been able to stop. More potent addictive form of meth impacts Portland's homeless. That stuff is there because we can't share that elsewhere. It gets censored. Thanks for checking it out. Here's from San Francisco. Officials. Veterinary tranquilizer identified in San Francisco overdose victims. If we didn't think that fentanyl, along with heroin and meth and super meth, was enough to do it, now we've got a little extra something. This is something extra that I've been talking about for a while because I've been watching this on YouTube. I mean, don't we all learn everything from YouTube? But no, I first started watching these videos coming out of Philadelphia from Kensington Avenue. And I'm like, that is something that I have never seen before. What is up with those people? Why are they like doubled over zombies in the middle of the street or on the sidewalk, or just absolutely crashed out to the point where people can't wake them up? Then I started kind of, reading into it and watching more and more videos. And so often they would indicate it's Tranq. It's Xylazine. What is Xylazine? You know what? Let's just start off with what I found to be one of the better notices. This is from Frederick County Health Department in 2020. This is out of a county in Maryland. October 7th, 2020, the Behavioral Health Services Division of the Frederick County Health Department has identified the previously unknown substance first reported in Frederick in 2020 as Xylazine. Xylazine is often used as a sedative, muscle relaxant, and analgesic in animals and is not approved for human consumption. Xylazine is found to be cut in heroin, fentanyl, and cocaine and is associated with tissue damage when injected or inhaled. When injected, individuals who reported the deep tissue injury starts as a small discoloration, purplish, at the injection site and progresses outward into an open wound. Individuals who have inhaled or snorted the substance report expulsion of what may be tissue from nasal passages. Xylazine has been involved in fatal overdoses in Frederick County. Narcan does not work on this substance, but since it's a cutting agent, often mixed with opioids, Narcan should still be administered. Reports indicate the substance is white and gray in color and turns pink when water is added. Xylazine is associated with blackouts and more intense withdrawal symptoms. It might also be known as collateral damage, Cardi B, Steph Curry, 550, Rampage, or Black Mask. Boy, that just makes you want to run out and do some of that, doesn't it? Good Lord, that is some nasty, nasty stuff we've got going on. All right. So that's what it is. It is, it's a horse tranquilizer. It's a large animal tranquilizer. People talk about cutting their finger off and not feeling it because, it just, no feeling. Oh, where'd my hand go? Public health officials revealed Thursday that Xylazine, a non-opioid veterinary tranquilizer, has been discovered in the bloodstream of 4 fatal fentanyl overdose victims. While Xylazine has been circulating in the illicit drug supply in the East Coast for several years, health officials said it's the first time its presence has been detected in San Francisco. This is the first article that I have seen on the West Coast. I did a quick scour. I hadn't really seen anything, but I've been talking about this. I don't know how long. Somebody wants to, go down the deep dive. But when did Sean first say Tranq? We could do that. I want to say it's definitely been within, call it the last year, when I first started seeing it, I started hearing things, Tranq, because ketamine has been a deal for a while, right? I mean, basically horse tranquilizer, and then microdosing ketamine. Okay, you got that. But this is literally not approved for humans, and it's supposed to be used on large animals, but they're using it to cut heroin and meth and whatever else, whatever opioid based stuff that they can cut, because it makes the high last longer. And so why wouldn't you want to do that? Other than, you blow your nose and half the nose tissue comes out. Oh, so gross, so nasty. Identifying xylazine in San Francisco as concerning, health officials said in a news release. That's a health official statement, isn't it? It's concerning. It's merely a flesh wound. Not so much here, but right here. Chris Farley was great. To date, San Francisco Department of Public Health has not received any reports of skin wounds associated with xylazine, nor xylazine intoxication or withdrawal. I've also watched a number of videos on soft white underbelly where people have talked about being on this type of drug. And what happens is they start shooting it up, something laced with xylazine, and it gets all infected. And then you just got to start shooting up that injection site, that area on your body where it's so bad. Then it just becomes a big open sore. That's why oftentimes you'll see these folks with open sores all over. It's just basically destroying them from the inside out. So these facts suggest that the drug may not yet be widespread, but San Francisco Department of Public Health and its city and community partners are working to learn more, share information, and prepare street response teams to recognize the impacts of xylazine and respond appropriately. Yeah, it does not apparently work with Narcan, which will revive somebody on opioid based. But since this is a sedative, a tranquilizer, the whole Narcan thing doesn't work. Medical examiner's office has been retesting overdose victims who died between mid-December 2022 and mid-January 2023 for any evidence of xylazine use. So we are on the cusp of this hitting the West Coast, and it will come. It will come. That's this guaranteed. Xylazine, colloquially known as Tranq, is a non-opioid veterinarian tranquilizer that is not FDA approved for human use. It's commonly mixed with fentanyl, heroin, and other illicit drugs. It can cause excessive sleepiness and respiratory depression, symptoms that appear similar to those associated with opioid use, making it difficult to distinguish opioid overdoses from xylazine exposure. So it slows the body down. It makes the drug high, whatever they're taking, whether it's fentanyl or heroin or whatever, it makes that more impactful for longer, and it slows the body down. And yet Narcan may not be able to revive the person, but I guess use it anyway, because, you might as well give that a shot. If somebody's down and out and doesn't look like they're going to make it, you might as well try, because maybe it brings somebody back. We don't know enough about this yet. Because this has been a Philly thing. As far as I can see, this has been an East Coast thing and definitely a Philadelphia thing. Because the zombies you see there, the drug zombies that you see in Philadelphia, you will not see those folks. You will not see a creature like that. You haven't seen much of that here on the West Coast. I just haven't. It's crazy. Xylazine can be smoked, snorted, or injected. It causes severe skin ulcerations that spread and worsen quickly. Repeated xylazine injection has also been associated with severe necrotic skin lesions, often requiring advanced wound care. These wounds may occur in areas of the body away from the injection site. Geez, just sign me up right now. Where do I get some? God, this just sounds like a party, doesn't it? All right. Yeah, I'm just going to shoot it up over here. Oh, some nasty stuff. Preliminary data from the medical examiner indicates that fentanyl, the primary driver of the overdose crisis in San Francisco, accounted for 72% of all overdoses last year. Here's our next article. Drug that worsens opioid overdoses spreads across U.S. A street drug that can worsen opioid overdoses increasingly make its way across the U.S. The drug is known as Tranq. When mixed with heroin or fentanyl, it becomes deadly. Xylazine can cause open wounds. Yep, we know all that stuff. Get to the good stuff here. Xylazine restricts blood flow through skin tissue, which is why it can cause ulcers in the skin. In those struggling with addiction, those wounds may go untreated and uncleaned, leading to more problems. Vice News reported the use of xylazine has risen dramatically since it was first detected in Philadelphia in 2006. So here we are years later, and its impact on Kensington Avenue is something else. I mean, that is just out of this third world type environment. Tranq makes opioids stronger and the effects last longer. Withdrawal from Tranq can cause seizures, and there has been no research into medications to help ease withdrawals. Well, I think you're going to start to see some. Tranq is also less expensive, which is another reason it can be used to cut opioids or other drugs, including coke and methamphetamine. People may be unaware that the drug they're using has been cut with Tranq and could be stronger than expected, leading to an overdose. Tranq is spread from Philadelphia throughout the country, recently being detected in San Francisco, where at least 4 cases. That's the one we just read. According to the San Francisco Chronicle, the city's medical examiner plans to retest. We just read that. So we are literally on the cusp of seeing this hit West Coast. So if you thought things weren't bad enough, you got yet another just freight train coming. And if you look at some of that footage out of Philadelphia, that you want to talk about drug addicted zombies, those people, if you can call them people, I mean, they are literally the walking dead. It is so bad. It is so nasty. Yeah, it's just, it's craziness. So why wouldn't this come to the West Coast? It's coming. It's here. It's in San Francisco. And if it's in San Fran, it comes up to Portland. It comes up to Seattle. It's probably already been in Vancouver. I mean, Vancouver, BC. It's going to hit. And when it does, maybe you'll say, hey, I heard about that in News for Reasonable People. I thought that guy was just talking out of his ass, but he called that one. And you're going to see this because we've got a massive opioid epidemic already with the fentanyl. Cause it used to be back in the day. Oh, don't do heroin because you might, that stuff's bad. You could overdose. Remember when it was just heroin you'd overdose from, and speed, meth? Okay, it's going to ruin your life. You're going to lose your teeth, but yeah, for the most part, you're going to live. I would say Lemmy from Motorhead is the Motorhead being a slang term for speed freak. I would say Lemmy from Motorhead is one of the prime examples of you could go a long time. What was he drinking? He was drinking, I think it was like whiskey. He'd do whiskey and then go do speed. I mean, that's just what Lemmy from Motorhead did. I mean, that guy, he lived to be like, I think is he 71, 72? But when he went hard, long live Lemmy Motorhead. Sad to see him go, but he had a full life for a, self-admitted drug addict for all those years. That guy led a full life. I mean, he just rocked out all over the world. What would happen if he got sober? Yeah, probably play terrible music, right? I mean, I hate to be that guy, but that's probably what would happen is, you just suck. Can't have that. We gotta have Lemmy leaving us with his memory. If you're not familiar with Motorhead, that's okay. It's a rock and roll thing. But, is this gonna come to Seattle? Is this gonna come to Portland? The next question I would have is, why wouldn't it? Super cheap. It's not even really illegal, right? But, is this gonna come to Seattle? Is this gonna come to Portland? The next question I would have is, why wouldn't it? Super cheap. It's not even really illegal, right? Because it's a it's a big animal tranquilizer. You can get it at the vet. It's not meant for humans, but neither is ketamine. So you got that whole thing. Remember back when Joe Rogan was saying, yeah, but I took the whatever drug that was that makes COVID better. And people are like, oh, Joe Rogan took, medication for horses. And it was administered by a doctor. There are some medications, believe it or not, that human beings and animals actually take. But Tranq, this isn't one of them. Shouldn't be taking it because we just read about what happens. You blow half your nose out, and where you inject it, and even where you don't inject it, you could have lesions come up. But, folks that are addicted to this stuff, they're going to try anything, and they're not necessarily going out and looking for this. But maybe they take it. And I believe that's what happens in like Philadelphia. They try it out in a community and you get a community hooked. And then eventually starts to move. You've got demand elsewhere. And then people are like, hey, try this. And so, that's exactly what happened with fentanyl, right? People were like, what is that? I just thought I was just smoking regular fake M30s. And then all of a sudden they're like, what's in this? And then they're like, I just want to smoke fentanyl, even though that's a question I get asked all the time. All the people in the homeless encampments that just wildly addicted to fentanyl, meth, whatever, heroin, why do they, if they know that fentanyl could kill them, just 2 milligram dose could kill them? Why do they do it? Because they're addicted to drugs and they're rolling the dice, and it's not going to happen to them. Statistically, it probably won't happen to them, but it happens to enough people where if it's your kid that's addicted to this stuff, yeah, you got some major concerns. Talking about watching a Jonathan Cho video where he was chased down 3rd Avenue in downtown Seattle by a kid addicted to meth and fentanyl, 15-year-old kid. The kid's coming after him with a hatchet. And, that kid is not making decisions that a normal human being would. And because he's addicted to drugs, people make stupid decisions when they're addicted to drugs. And his grandma, how terrible is that for a grandma that's raising 3 kids because the mom's addicted to drugs? So you've got these intergenerational deals going on. It's so sad to watch because what it takes to get these people into treatment that don't want to go. And that's why these homeless encampments keep growing and growing and growing, because they don't want treatment. They don't want housing. They want to keep doing what they're doing. They're going to lie to the media, and most of the media just accepts their explanation, which is, I've applied for housing, but I don't get in. I really want to get into some housing, but it's not happening for me. Nobody's come by and said anything to me, as far as caseworkers go. That's the excuse all the time. And oftentimes they'll just have lesions all over their face, or, they're just gaunt looking. They've been on the streets doing drugs for years and years and years. And you're like, yeah, you're not really telling the full story here. So these kinds of environments, we got 15-year-olds just wildly addicted, and you got people who've lived in the streets for years and years and years. You want to take one look at Kensington and tell me that isn't going to be Portland in a year or two? Yeah. And when that does hit, you're going to see a whole new level of outrage from those on the right. And then you're going to see, but we love our fellow human beings so much, and we're so compassionate for them. We want them to make the decision to get into treatment on their own. They have to be the ones to make that decision. And in the meantime, you're going to have even more people die from overdose. I just don't see it any other way. So the situation you've got going in a San Francisco, in a Portland, in a Seattle, and in LA, this kind of stuff, because there's demand for it, it's going to come, and people are going to go, give me some of the Tranq. Give me some of the Cardi B. Give me some of the Steph Curry, the 550. I don't know what the reference to the 550 was, and what were some of the other names. This is important stuff. We need to get this right. Rampage or Black Mask. Okay. So as if the super meth we've got now isn't bad enough, we're going to throw a little rampage into there. Watch out windows in Portland. Watch out windows in San Fran and downtown Seattle, because they're coming for you. Somebody that's got a little bit of fentanyl, heroin mixed with some 550 Steph Curry. It's just crazy. And somehow we think that legalizing drugs is the answer. I'm going to have to say, this isn't going in the right direction. This is not going in the right direction, but we're going to watch as we just take this whole social experiment of, decriminalizing drugs and decriminalizing criminal behavior that people are using, such as robbing and stealing stuff to feed their addictions. We're watching this unfold in front of us. We're watching these homeless encampments evolve. We're watching these open air we haven't even really talked about the open air drug markets, like the Tenderloin. They're trying to shut that down. Good luck with that. Good luck with that. Because until you get these folks into the treatment that they need, this stuff's just going to run rampant. And that's why I say, coming to a homeless encampment near you in the immediate future. You're going to see it because, the drug trade's coming right up the southern border. Yeah, they're not dumb. Hey, if they can sell this stuff for even more by cutting it with something that's readily available, they're going to do it. They could give a crap. They know that fentanyl's killing people. They could give a crap. They're just about making money. Mexican cartels bringing all this stuff up. Mexican cartels. I mean, the last podcast I did was San Francisco is reimagining and rethinking its approach to being a sanctuary city because they've got so many undocumented illegals bringing fentanyl into the city. And they know it. Health officials know it. So all of a sudden in San Francisco, you've got an issue where you've got, you know what? We really, in our heart of hearts, we really wanted to be on that whole, sanctuary city thing. We really believe in that. But geez, those people are bringing in some fentanyl that's killing our residents. We can't have that. So here's what we're going to do. Just about everybody is on board with the sanctuary city deal. But if you've been busted for bringing fentanyl in, we're going to have to say, no go. You can't come to San Fran. We're good with everybody else. But undocumented migrants coming in, bringing in drugs, we're a no-go. It's like, that's been one of the major complaints with the whole open southern border crisis. They're bringing drugs right up through it. They bring it right up I-5, Interstate 5, comes right up United States, right? I mean, this is just, we know this to be true. And yet we're told, hey, the border is mostly closed. I mean, it's almost just hermetically sealed, right? I mean, isn't that what Karine Jean-Pierre tells us? Isn't that what, our border czar tells us? Kamala Harris? It's closed. Isn't that what, everybody that's in governmental positions right now on one side of the rope says? There's no problem there. There's no reason you need to go to the border. It's all good. I mean, they might be bringing up a little bit of drugs. And then with the open border policy, you see the fentanyl numbers just rise. And you're like, how is that happening? I don't know. It's just happening. Must be a lot of Cardi B. It must be a lot of collateral damage. These are some good names, aren't they? Collateral damage, Cardi B, Steph Curry. How do we get Cardi B and Steph Curry out of this? I want to know. If you know, leave it in the description for me. Leave me a comment, right? All right, that's it for me. This was your Tranq/Xylazine 101. There you go. Now you know more than you ever need to on just a crazy drug that's going to hit our communities. It's hitting it now. It's in San Fran. It's West Coast. It's going ham. All right, that's it for me. Thanks so much for being here. I'll catch up with you in the next one. Bye for now.